Delivering vaccines to the nooks and crannies of Nigeria in the right temperatures is a complex operation. In order to help manage the country's cold chain system, higher biomedicals and Intertrade say they are willing to work with the government to provide high-quality cold chain equipment, which will allow health workers deliver life-saving vaccines to Nigerians. Our correspondent, Lois Apasamu, reports.
Vaccines are substances used to stimulate the production of antibodies and provide immunity against diseases in humans. They decrease healthcare costs to both patients and the healthcare system. These vaccines have to be stored in the right temperature-controlled environments to ensure they do not lose their potency. Speaking during the Higher Biomedical's Global Primary Healthcare Partner Conference, Managing Director of Intertrade Limited, Engineer Gosa Ogedegbe, highlighted the importance of an efficient and sustainable cold chain to the healthcare system.
Vaccines are needed, and if they are not properly stored, the potency will be gone. The WHO has PQS standards for all equipments that should be used for vaccine storage. And these are very high standards, higher than the normal conventional standards. I mean, like everything, it's going to take time, but it has gradually started happening with the primary healthcare agencies and the donor agencies to ensure enforcement.
Also speaking, Director of International Business Operations, Higher Biomedical, Mr. Peter Pedersen, said their product research will focus on multiple vertical fields to create value for partners and stakeholders.
Investing in the future for life science and biomedical products and solutions. So you're dealing with the right manufacturer, and what's important for us is that we have the right partners and key stakeholders on the ground around the world.
The chairman of the 37 executive secretaries of all national primary healthcare boards, Dr. Muhammad Usman, said the government has put mechanisms in place to close the gaps and maintain the cold chain equipment in order to provide citizens with potent and effective vaccines for their health.
The present management of national primary care under the leadership of Dr. Faisal Shaibu, he has brought out a policy in that the suppliers don't just come and bring these equipments and dump in our facility. Part of the package is they have to train the personnel at the point of delivery, and we have to have a contract with them, signed MOU that the state government, the Ministry of Health, the agency sign of undertaking for maintenance. So there's this tax shifting because we don't have enough biomedical engineers in the states. Most of our health workers are being trained on simple maintenance of cold chain equipment.
The conference also featured a panel discussion where stakeholders discussed sustainable medical cold chain and its effect on vaccination. Lois Apasambu, ASO Television News.